Alrighty, what is up, everybody? Welcome back to my channel. And tonight I'm going to talk a little bit about, as you can tell by tonight's video, um, about, I'm going to look through some of these notes with you guys tonight. And I do give you guys full consent to, that I'm giving to you. I give you guys full permission to take it or leave it. But this is what happened with me whenever I got wheeled back to the OR and everything. So the specimens is a fancy word for something that specimen, think of it as like a sample. So the specimen they took out of me, like I said, was an extra fallopian tube, cysts, lesions. A lot of lesions were found, a cyst, a lesion on my posterior called the sac lesion. I have no idea what number 6 even is, but that's okay. We learn as we go along. And obviously my appendix. So pretty much the details of the procedure were they gave me pre-medication, which was 1,000 milligrams of acetaminophen, which is Tylenol, and 30 milligram intravenous Ketorolac, which Ketorolac is a big fancy term for, I'm pretty sure, fentanyl, because that's what he said he gave me was fentanyl as a muscle laxant. The patient was previously counseled the risks, benefits, and alternatives to the planned procedure. We all knew, obviously, the procedure. We knew what was happening. That's why we said go for this procedure. They said after obtaining the consents, because you have a right as a patient to deny medical treatment. That is your right to deny medical treatment, but I consented for it because I was trying to figure out what was wrong with me. Um, I was taken to the OR, the operating room, with IV fluids running, which IV shot for intravenous fluids. I was administered general endotrachea anesthesia, which means I had a breathing tube into my throat, giving me the anesthesia. The trachea sits below, I believe. I don't know my human anatomy too well, but the trachea, I believe, sits right near your lungs. Near your lungs, but not right by your lungs. It's in your throat. Correct me if I'm wrong, but that's where visually I see the trachea to be. I was prepped with chlorhexidine. Still, every timeout was performed. I don't know too much about timeouts. Oh, why they call timeouts in the OR before surgery. My assumption is to be sure they have the correct patient on the table under anesthesia and not a different patient. Then I had a catheter was placed. And then the surgeon was regowned and gloved, and attention was turned to my abdomen. Then I'm just going over everything briefly because I don't want this to be a very long video for you guys. They confirmed through the laparoscope, and the CO2 gas then was turned on, and the abdomen was inflated after injecting Marcaine into the skin fascial region. 2 8-millimeter incisions were placed in the skin, 2 cm medial and 2 cm superior to the anterior superior iliac spine bilaterally, and 8 m anterior superior spine bilaterally, and 8 mm were introduced to the abdominal cavity. I don't know what half this stuff means. I'm just guessing that my guess is that's the stuff they use to pump up your stomach so they can see everything better, your abdomen better. It says, through evaluation, the pelvis was made with the findings as noted above. The robotic platform was docked. A large suture cut needle driver was inserted into the right upper quadrant. Right upper quadrant, I think. Right, not near my head, like right here, I think. I don't know. Before sitting at the robotic console, she left the room to speak with Dr. Griffith's general surgery regarding the appendix. So he, of course, agreed with my surgeon that it needed to come out. He said because that I wasn't having any symptoms for appendicitis, there was no need for antibiotics. Because I had one anaphylactic reaction to a different type of med, they think I might be allergic to different groups of meds now. So that's why I didn't get sent home with antibiotics, even though after an appendectomy, they send patients home with antibiotics. She went out to speak to my mom regarding the findings and recommendation for the appendectomy. She discussed not to administer antibiotics, but to monitor for signs of infection. So, the one part that surprised me the most, though, was looking over these notes, is she left the OR. She returned, and sat at the robotic console at a setting of 10 watts, continuous left, the left accessory fallopian tubes were excised at their bases. The red lesion on the epithelial junction of the left ovary was vaporized. The lesions on the left ovarian fossa and left posterior broad ligament were circumferentially outlined and dissected from the underlying tissue with caution to avoid the utero, which I believe is a major artery that carries all the blood to the uterus, I think. I don't know. The lesion of the posterior cauda sac was outlined with the laser. The right patellar cyst was excised at the base. The red lesion on the epithelial junction of the right ovary was vaporized. The lesion on the right posterior broad ligament was circumferentially outlined and dissected from the underlying tissue. The lesion on the posterior cauda sac was then dissected from the underlying tissue. Then it says pelvioplasty then was performed by reapproximating the peritoneum over the excised areas with 3O Staphyfix in an indicating fashion. The robotic platform was then undocked, and the surgeon rescrubbed and resumed bedside care. The appendix was visualized. A right load stapler was used to transect the mesoappendical tissue. A blue load stapler was used to transect the appendix at the base. The pelvis was copulously irrigated. The excessive fluid was sectioned from the abdomen and pelvis. CO2 gas was discontinued. CO2 was suctioned from the abdominal cavity. They removed it. The trocars were then removed from the abdominal wall. The catheter was discontinued after that. Said the patient was extubated. I think that means they took out the endotracheal tube in the operating room and transferred to the post-anesthesia care unit in stable condition. A sponge, lap, needle, and instruments counts were correct ×2. The patient did not receive any post-op antibiotics. This operative note was created while at the bedside with the patient in the post-anesthesia care unit. And my insurance is kind of funny. My secondary insurance is kind of funny with who is and isn't allowed in the OR with you. So if you're not a doctor or assistant, you should not be in the OR besides the anesthesiologist. And it says, I understand that of the section of it's 1842 B70 of the Social Security Act generally prohibits Medicare physician fee schedule payment for the services of assistance at surgery and teaching hospitals when qualified residents are available to furnish such services. I certify that the services which payment is claimed were medically necessary and that no qualified resident was available to perform the services. I further understand that by these services made are subject to post-payment review by the Medicare carrier. My assistance was necessary throughout the procedures for passing of the suture, retraction, irrigation, and general bedside assisting of the robotic platform. So I don't understand what half these medical terms mean, but no wonder I was so for a couple of days. That was a lot, honestly, that they did. So if you there's I see 5 people watching, so if those 5 people have any questions, go ahead and ask away, but I don't know, for whatever reason, I cannot see the comments come through on live chat. So someone could, maybe one of my mods, type something so I can see that you guys are here and everything. I would greatly appreciate that because I'm, for whatever reason, am not seeing any comments, which is weird, come through the live chat. If you guys have questions, go ahead and answer them, and I will try to answer all of them the best I can. Hold on. Participants. Maybe I think I may have figured it out. I don't know. Go ahead and try to type something now. If it's not letting you guys do it, one of my mods message me if you can't, and then I'll figure something out, and hopefully we do the live stream then if I can't get any comments to show up. What, Calvin? Ollie would like to know what happened in hospital. Who? Ollie. Ollie's on. I can't. Why am I not seeing anything? I can relay back and forth plus play mod. Okay. So I'll text it. Hold on, Joe. Hold on. Let me get Joe on FaceTime here so he can talk me through on how to get the comments back up here. Because I have to meet you guys for a quick second. Hey, Joe, I need your help. Hold on, let me try editing something here. Live chat. Enable, allow live chat to reply. Somehow, everything's enabled. Live chat's enabled and everything.
Yeah, it might be YouTube glitching.
Okay, I'll text Calvin and tell them that here's what I'm gonna do. I'm gonna create a new stream link, and hopefully that works. I'll have Calvin post, she's creating a new stream. Give her a second.
Unless YouTube is updating something, and it might just be stupid all day.
Yeah, I'll let Calvin know. I'll tell Calvin to post something to the group about that. Thank you. Bye.
Okay.
YouTube drunk. Yeah. Chat. I'm gonna go ahead and create a new stream, guys. I'll catch you on that new stream.